so welcome to the next session in the ST3 interview podcast series. And I'm delighted to say we're joined today by Miss Apoorva Khajuria, who's currently an ST3 on the Northeast London Percival pot rotation. Hi, Apoorva, how are you doing?
I'm good, Aram, how are you?
Yeah, not too bad, thank you. So Apoorva and I actually work together. It's a blast from the past. But today we're going to be talking about one of the, I think, trickiest stations in the ST3 interview, which, a lot of people have commented. And that's the prioritization station. It's the one station that a lot of people, I think, have said they can't really revise for as such. So it'd be good to get your thoughts on it, Apoorva. So if I could just kick off, I think, and start off, how did you go about revising for the prioritization station?
Yeah, so first of all, I think I agree. Prioritization station was one of the most challenging, especially for me personally. It was one which I really struggled with at the beginning, really had to work hard to improve my technique. The things that I did when I was preparing for that station was essentially reading through various scenarios through various resources that I had, and practicing speaking and discussing them and different aspects of them, either by myself or preparing with colleagues or supervisors, so consultants or senior registrars, and to really sort of pick out for each scenario what the crux of the scenario is, or the specific thing that they're trying to get you towards, and really sort of bring that out early. So that comes with practice.
Okay. And I guess, when I was preparing, it was, you have two types of scenarios. You had one, you have to plan the list for tomorrow type scenario, and one where you're at handover and you've got these number of patients to see, prioritize. Did you get one of each, or was it two of a specific type of scenario?
It was actually one set of questions, okay. One set of the clinical scenarios. There were about 6 or 7. And the type that I got was the one where you're discussing the cases in order to prioritize them for the next day for the theatre list. So it's not a handover as such, it's just prioritization. Yeah.
Okay, fine. And what were sort of the key things that you had in your head as to how to go about doing the station?
So again, systematic approach is really important for all of the scenarios and all of the stations in the interview. So that's what you need. So for each one, take time to go through them in detail. Some people try to talk a little bit about each one and then keep going back and forth, and that can really ruin the flow for the interviewer and yourself. So I think it's important to take each scenario one at a time, go through it in as much detail as you can, being mindful of the time, and then make sure you just get through to the end, at which point you can summarize and give your actual prioritization list.
Yeah, and I think that's really important, because there are various different ways of revising for these types of stations. And you mentioned that you spoke to your colleagues at work and registrars, consultants, and had practice doing it. Were you actually able to practice doing this in real life, or were the lists already made by the consultants and you just going to discuss with them how to go about arranging it?
Yeah, so I was quite lucky in the clinical training and experience that I've had. I've had the opportunity to practice this in real life, maybe not in such a formal setting as is in the interview, but you do start to think about these things at work when, for example, if you're working at a major trauma center and you have an open fracture case that comes in the night, and you have to think, when should this patient be going to theatre? Does it need to go immediately? Can it wait 12, 24 hours? And you think about the BOSE guidelines. So all of these things fit into your clinical practice, but it's all about bringing it out and talking about it in the interview to make sure that the interview knows that you know all this. So you might know it already, but unless you say it, you're not going to get the marks. So.
Fine. Okay. So if I understand correctly, you talk through each patient and then justified why you put them wherever you put them on the list, one by one, as you were given them, rather than kind of going back and forth between patients or stating your order at the beginning.
Yeah, and it doesn't mean that if you get to the 5th or 6th scenario and you think, oh, hold on, there was actually a pediatric case, or there was another aspect of it that I missed. You cannot obviously go back and mention that, but as much as you can, try to bring out all of the key points for each patient as you're going along, just to keep that flow.
And I guess the balance is, you don't want to run out of time. And a lot of people say that, oh, I just want to state my order first and then I can talk through them so I don't run out of time and I've given my order. Did you find they cared about what order you had, or was it more the justification?
I think the order made up a small proportion at the end. So I think the justification is more important. And that's definitely something that it took me a while at the beginning to get my head around, because I spent a long time in sort of practices where I would sit in silence for about 2 minutes, reading the scenarios and thinking, okay, that's that one, where's that one going to go? But sort of as I became a bit more comfortable with the station, I realized, well, actually, I'm expected to discuss this, with my interviewer. So I need to talk through all of it, and then I can sort of justify everything at the end. And time-wise, I think it just comes with practice again. It's something that, that is definitely a risk that you might run out of time. But to be honest, I think they won't have that much that you can say for each scenario that you would run out of time. So, the interviewers, whoever's asking the question, that each scenario will have a set number of points you need to make sure that you've checked off. And once you have, you will be okay for time. Yeah.
I would say exactly the same thing. I used to sit there for a good 3-4 minutes and think this is like completely dead time. I need to say something. At the same time, trying to work out who's going where in the.
And it's really difficult, right? Because you're trying to think and also not come across as if you don't know what you're doing at the same time. It's quite challenging.
Yeah,
it's actually naturally more easy to just say what you're thinking, and that's exactly how you're going to get the marks. So it's definitely the right way to go, I think.
A lot of people have, commented that that's kind of the best way to revise, but some people have found that courses have been useful to help revise or pick up on these types of skills. Did you do any courses? Did you find them helpful?
I remember trying to sign up to a few courses, but they were all sort of booked up. So people booked them up quite early. But despite that, I did all right in my interview. I don't think courses are a must. But having said that, there are some courses out there, and we can obviously share those later on with people if they're interested. But yeah, definitely, if you think you benefit from courses, book them early. That's the only thing I would say. But courses are not a must. It's more just practice. Use the online resources and practice. Myself and a couple of others from ST3 were actually trying to formulate sort of a question bank with practice questions. So that's something that people might find useful as well. So I think it's more practice, but if you find courses helpful, just book early. That's what I'd say.
And in these sort of scenarios you get in the prioritization station, I guess were used to being SHOs and therefore discussing with our seniors a lot. But how do you strike that balance between not bothering your senior every 2 seconds for every patient, but at the same time, if there's something important, you need to let them know? How did you kind of get that balance right?
Again, I think I've been quite fortunate in the experience I've had as part of core surgical training to help me develop that sort of balance. But I think it's really difficult, especially for people who are going to be applying as international candidates, because with such limited experience in the UK, I think it can be really hard to know what you shouldn't be discussing with a senior. One way around it is to discuss or have a chat with your colleagues, not just registrars, but SHOs, to realize, that fine balance of what SHOs are expected to do and what registrars are expected to do, and what the responsibility of a registrar is in sort of the team. So it's definitely worth talking to people who are in training posts to get a better idea. Okay.
And I think now I want to come to the C word, COVID. So obviously that's affected hugely how this station is run, namely that now it's in a virtual format when you applied. Did that play on your mind? How did you prepare for the virtual format rather than face-to-face speaking to people about this?
Yeah, there was a lot of anxiety in my cohort because of the virtual interview. It was the first year that they were doing it. So there's a lot to think about, things that you may not consider till much later on, but it's important to consider nevertheless. So for example, you still need to be obviously dressed formally. It doesn't just mean your top half, just dress like you would for the interview, because it creates that aura of, I'm in a formal professional setting. And it gets you in the right mindset. Having a clear background. I went for a nice plain white background. Some people opted to have some plants or something in the background.
The feng shui.
Yeah, and it can create a nice ambience, but at the same time, it can be distracting. So just think about what sort of image you're trying to portray. It is a professional interview at the end of the day, even if you are in your living room. So just consider those things, and making sure noise. So, you know, having signs up to make sure people don't enter the room. I'd put a sign out on my front door that I don't want any post. So just divert the post to my neighbours.
Send it somewhere else.
Yeah, literally forward it somewhere else. So those sort of things, they might seem a bit extreme, but they're really important, because, you know, you don't want to be that one person who the doorbell rings in the middle of your interview or something like that.
Yeah, absolutely. No, I was going to comment, actually. You went for a very nice neutral background today.
Oh, thank you. Bit of grey, bit of white.
Yeah, no, even though this is not supposed to be formal in any way, shape or form, but yeah, I noticed. I guess moving on now, what's the kind of biggest mistake that people make in this station, do you think?
It's something we've talked about already. I think not talking, not giving justification for your order is the way you will not score marks. So you need to be talking as you're going through. If some people still want to give the order first because they've had a quick look through and, you know, their brain is able to formulate that order that quickly, that is fine. But you do need to actually justify every decision that you've made, and they might question you on it. So in my interview, one of the interviewers did actually ask, well, why have you done this? You know, so they were actually they were probing and trying to get me to give them a particular answer. So it became a bit of a discussion, and then I finally gave them the answer that they were looking for. So, you know, yeah, I think that's the main mistake. So not speaking and not giving your justification for the prioritized list, because the list is not the end game. The whole thing is about, you know, your rationale for your decision.
It's the journey, basically, not the destination. I had to give it some like cheesy quote in there, so
yeah.
I had to go for that.
It's absolutely right, though.
Fine, and I guess talking early will make sure that you can get all your points out and not run out of time as well, I guess. So I guess it has that twofold benefit. And kind of turning it on its head, what's the single best piece of advice, or is it just talking early? Is there anything else that you thought, you know, really helped you in the station?
So obviously there's I think an unsaid sort of thing in the scenario that you need to have the clinical knowledge. So we've talked a lot about justification, but what are you justifying? The thing you're justifying, the rationale that you're giving, is why you're clinically prioritizing these patients in a particular way. And that requires clinical knowledge. So, you know, you can be really good at speaking and portraying yourself on the virtual platform, but you do need to have some clinical knowledge. So things like BOSE guidelines, and not just which BOSE guidelines you're using, but specifics from them. So indications for open fractures going to theatre, for example, and that's something you'll see in clinical practice as well. So it's completely relevant to everyday work as a registrar, and you know, that sort of thing is really a must-have before you can do well in the scenario.
And I guess, do you think, you've probably touched on this a bit earlier, but do you think there is a right order of the operating list, or can it be a few different orders and doesn't really matter as long as you justify them?
Yeah, I think generally there will be a vague correct order, and there will be no sort of catching you out. It will be fairly straightforward, as long as you have that basic clinical knowledge. So that will all, I think, make sense. There might be one or two that can be sort of that are interchangeable, and that's okay because they won't penalize you for that. But you know, I keep using the sort of open fracture as an example because we see that quite commonly at major trauma centres. But for example, something like that being postponed to the next day because of lack of capacity, for example, may not be appropriate. So yeah, so I think it'll be fairly straightforward. There might be a few that can be changed around, but again, you won't lose marks if you get them in a slightly different order.
And as you say, working at a major trauma centre made you comfortable with these open fractures and other kind of scenarios that may come up, but some of the people who are applying may not have been able to work at a major trauma centre before application. So how do they go about trying to, you know and demonstrate knowledge that you can only really get from managing these patients firsthand?
Yeah, so I think one thing before I forget to say is it's really important establishing your environment. So although I'm speaking as if the scenarios would be based in a major trauma center, they might not be. So that can actually be something, you know, that you have to be mindful of. Know your environment and the setting that the scenario is putting you in, rather than assuming I work in a major trauma center every day, therefore, you know, this scenario, I'm in a major trauma center, I have all of my sort of subspecialty colleagues, etc.
Did they tell you that in the actual interview? Did they say you were in a major trauma center? You were in did you have to ask?
I can't quite remember, but I do remember when I was practicing, I would ask that question to my examiner. So I wanted a bit of background as to, you know, what do I have, you know, at arm's length? Do I have X specialties? And, you know, is my consultant, you know, covering lots of sites? What's the scenario? So it's good to gauge that early, because it allows you to give more personalized answers.
Yeah, absolutely.
And I think they'll appreciate that as well, so that you've had that sort of foresight to think about those things.
I found that really helpful as well, in terms of not just that, but also how long is your operating list going to be? Do you have X-ray in the morning or the afternoon, and all this kind of stuff that can, you know, screw up the order of your list, basically.
Yeah, exactly.
So
and I think not having worked in a major trauma center, so definitely speak to people who have, find colleagues, or if you're working in a district general hospital, speak to your consultant who may have experience in a major trauma center, just to get a bit of an overview of, you know, how those centers work versus smaller units.
I don't know about you, but I used to find it more difficult in the scenarios where you're in a district general hospital, because in a trauma center you're a bit spoilt and you say, oh, just get this neurosurgeons or the plastic surgeons to come along just from upstairs. But the district general hospital, it used to kind of, you know, have to really get my head around the fact that you don't have all these people here and you have to pick up the phone or send them across. And
I think you may actually be more likely to contact your consultant in a district general hospital, because you're limited to what you can achieve in a smaller center, and therefore the transfer might be the one thing. So you need to make sure you've said all the things you would do up until the point a patient may need to be transferred somewhere else. And obviously if that's happening, it's worthwhile informing a senior colleague.
And I know you mentioned that the main type of scenario you get is that planning the order for the list, but the other type of scenario, which is where you're at handover and you've got X number of patients to see and you have to prioritize which ones to see and what to do. In that scenario, you tend to have an SHO with you who's on the night shift or, you know, on the day shift. What's it safe for you to be able to tell your junior colleague that you're on the night shift to do?
So I think it's important to mention that, you know, it's good to know what your SHO feels comfortable doing. So SHOs, for people who don't know, senior house officer, so they can range from quite junior doctors to doctors who've had a lot more experience and feel a little bit more comfortable doing orthopedics because they've done it before. So it's important to talk to the senior house officer before you give them tasks to complete, and double check with them that they are happy doing them and make them feel comfortable. So I think that's really important. It's basic things. So, you know, things like bloods, cannulas, the usual stuff that you would expect a junior doctor to do on the ward is what you would sort of hand over to them. Initial assessment of an acutely unwell patient, you know, that's something that they can start doing. So they can do an A2E assessment on the ward, etc. And then you have to just always sort of give a bit of safety net in your answer, in that, you know, make sure you've done the assessment and then contact me. So always have that communication loop with your SHO, so everyone is in the know of what's going on in the patient. Essentially, you're working to, you know, in the best interest of the patient, and the patient's safety is like the main thing. So as long as you've highlighted that, I think you should be able to hand over a lot of things to the SHO to crack on with whilst you're dealing with other matters. But just making sure the SHO is happy with that, and there's no sort of doubt from their side. That's quite important.
Yeah, no, absolutely, I agree. Now, I guess I would say that's a lot of the things I want to speak about. Is there any kind of overarching themes or comments that you want to make about how you found the station? Did you over-prepare? Did you under-prepare for the station? Or did you get it just right? How long it took you to prepare for the station?
Yeah, so, I mean, everyone's quite different with their interview or exam preparation. So I think for me, I prepared for a few months prior to the interview. And like I said at the beginning, prioritization was one of my weaker stations in the beginning. And I really worked hard to sort of perfect my technique, practice giving the answers and delivering them in a way that was quite succinct. and also timing. So every time you're practicing this, you need to time yourself, because you need to know how to pace it so that you have enough time at the end. So yeah, I think practice is a key. I'm working on writing a question bank at the moment with my colleagues. So, you know, that's something that I think might be quite useful, and I'm happy to share that with you at some point, Aram. But yeah, definitely, I think practicing is the key. But leave enough time to practice. So don't start your interview prep, you know, a few weeks before. You need more time.
Yeah, as I think you've kind of pointed out, it's like an exam pretty much, isn't it?
Yeah.
It's not just rocking up for an interview. It is an exam. So as we don't know what format the interview is going to be in, or it hasn't been confirmed anyway for next year, as far as I'm aware at the time of this, you know, it's useful to hear your sides from the virtual format, in addition to people who've done the face-to-face format. Listen, it's been absolutely fantastic speaking to you. Do you have anything else you want to say before we wind it up?
No, just good luck to everyone applying, and work hard. It's the final sort of push when, you know, interviews are coming. So keep working hard, and, you know, reach out to people like Aram, myself on social media, you know, if you need any tips or sort of just some comforting words, we're here. So yeah, good luck.
Yeah, thanks for the shout out. No, I appreciate that. Absolutely, yeah. I'm more than happy to answer questions. I'm sure you are as well. Listen, thank you very much for giving up your time today, Apoorva. It's been really appreciated. I'm sure a lot of people are going to appreciate it. Join us next time when we'll be looking and dissecting one of the other stations. And I think all that's left for me to say is thank you once again.
No worries. Thanks, Aram.
Take care. Bye-bye.
Bye.